is Alicia Crowder, and I'm going to be talking to you all today about sickle cell disease. But first off, I'm going to show my audience. Okay, so sickle cell disease is a blood inherited disorder. It is a serious disorder in which it makes the body make sickle-shaped red blood cells. It's kind of like a crescent shape. So your normal red blood cells are flexible and soft. They're kind of like a donut shape, and it makes it really more easy and manageable for the red blood cells to flow through your blood vessels when they're not sickle shaped. The purpose of the red blood cells, they actually have a protein, an iron protein that's called hemoglobin inside of the red blood cells, and the purpose of that is the red blood cells carry oxygen to and from your lungs. Individuals who live with sickle cell disease, they have the crescent-shaped red blood cells that become hard and sticky, and it makes it very hard for the red blood cells to flow through the blood vessels. Individuals with sickle cell disease, what happens is the red blood cells will get sticky and hard, and they stick kind of like to the walls of the blood vessels, which makes it hard, and then the red blood cells aren't flowing through the blood vessels nor to the lungs. So these individuals will actually have pain because of the red blood cells blocking the organs and the joints, because red blood vessels, the blood vessels, are throughout the body. So these individuals will have pain, can have pain everywhere, anywhere. Sometimes it's been found that they have difficulty where they lose their spleen at an early age, because the purpose of the spleen is it actually fights off abnormal red blood cells and bacteria. So because the spleen overworks with individuals who have sickle cell, it stops working sometimes in individuals as early as age 5. It's not working anymore. So this will cause them to have difficulty not only with pain but fighting off infection as well. Sickle cell disease affects individuals who are African American, who are living in the United States, from the Mediterranean, from South and Central America, and India as well. These are some of the places. Individuals who are having pain, they one of the ways to kind of stop the pain is dehydration. These are some of the factors that helps these individuals. It's kind of, sorry, I lost my train of thought, but I'll keep going. The way that it is diagnosed is actually through a newborn screening. That is actually a law now. This is a law that has been passed in the United States, so it's actually in all 50 states where this newborn screening has to be completed now on newborns. And usually parents will get a letter in about a week letting them know that if their child actually has it. The way that it is inherited, it has to be inherited from two parents. Both parents will, each parent would actually have to have either the disease or the trait. Or an individual can just be living with the trait and have no symptoms of sickle cell disease, and the way that is inherited is just getting it from either parent. The way that sickle cell disease is treated is through where if they're having pain, they have to be hospitalized. And so they would have to go into the hospital to get opiates in the family of morphine and Tylenol, lipocodeine, and medications, pain medications like that. IV fluids or whatever are a main way that they still try to help individuals, is because that's going to help get those red blood cells flowing and get it through the blood vessels. Antibiotics is another way that it's treated, because again, remember that they have a hard time fighting off infection. Oxygen, because the lack of the red blood cells getting to and from the lungs, then sometimes the oxygen will have to be administered. Sometimes individuals who are severely anemic have to get blood transfusions. So this is some information still about sickle cell disease, and I hope that it was helpful to you all. Individuals who are living with sickle cell disease now, back from 20 and 30 years ago are living longer and healthier lives now. So I'm fortunate that you know that there's more resources and more pain management out for individuals who are living with sickle cell disease. So I hope that this was helpful to you all, and thank you for listening.